Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. It's Saturday morning. We have another busy weekday at the office. Let's go over a consultation that I received at the end of the day yesterday. We had a pre-adolescent patient, around 10 years age, female with severely ectopic, labally displaced canines. So her upper threes were really on top of the upper twos. We're catching this a little bit late. This was her first consultation with us. And she had significant retrognathia, so a class 2 division 1 malocclusion with severe labally displaced canines and high dental anxiety. Now, I think a lot of orthodontists would immediately prescribe a phase 1 expander, even though she's a little bit older for phase 1 treatment, or recommend for BCHI extraction, or both. I think they're both very acceptable approaches. So what I talked to the parent about is, because she was 10 years of age and the upper threes were so displaced, I said it's not a bad idea just to take a BCHI and see if we can get a little lucky with some autonomous correction. But introducing that idea immediately brought tears, and you could really sense that this was going to be a hard procedure for the child to have those teeth taken out. And I spoke to the parent, and she mentioned that for previous baby teeth extraction, deciduous tooth extraction, the child needed to be sedated. So my rule of thumb is I do not like to have children sedated just for deciduous tooth extraction. I do not think the risk reward is worth it. So here's what I told the parents. I referred to an oral surgeon for a CT scan to determine if the laterals were resorbed. Because if the lateral incisors are resorbed, we know that we're going to be doing an upper 2 extraction and a bilateral canine substitution. Because there's no way this child is not going to get either the upper 2s or the upper 4s extracted. There's just too much of a discrepancy between the upper and lower jaws. So we know it's going to be an upper tooth extraction. Best case scenario, we take out BCH&I, the canines self-correct, and we take out the upper 4s. Worst case scenario, which is not even that bad, the canines resorb through the lateral incisors, and we just do a bilateral substitution. But I told the parent that if after the CT scan, the canines have resorbed the lateral incisors, then we have a decision to make, because it seems like it's perfectly acceptable to just let the canines continue to resorb through the lateral incisors and basically do the treatment for us. And if the child's nervous right now about extractions, then we can just simply do one sedation a year from now, where we take out the resorbed laterals and the remaining deciduous teeth and just simply do a bilateral substitution, which will address the class 2 malocclusion and the ectopic canines. So essentially, if we know we're going to need to do upper extractions and the canines are resorbing the lateral incisors, just let them continue to resorb the lateral incisors, provide good consent to the parent. And really, the thing that you need to make sure is that the canine is not so ectopic that it starts to resorb the central incisor. And I've always said during my lectures, if you have ectopic canines, your job is to preserve the central incisors, not the lateral incisors. It may be too late on the lateral incisors. So the pearl here is we provided a lot of consent. We told the parent we really have a few options. The first thing we did is we referred for a CT. If the upper 2s were resorbed, we're going to go ahead with a bilateral canine substitution a year from now, maybe a year and a half from now. Just simply let the canines resorb through the lateral incisors, make sure they don't touch the centrals. If they have not resorbed the laterals, we have a tough decision to make. Do we do sedation and take out BCH&I with the hope of preserving the laterals and taking out the upper 4s later? Or do we just continue with our course and just let things be? But I don't like to sedate little children for deciduous tooth removal. This was a long pearl. Let me know what you think about this treatment approach on a class 2 division 1 malocclusion on an anxious child where we know we're going to need to do upper extractions and the canines are severely ectopic. Hope you enjoyed it. Thank you guys so much for subscribing to this page. Thank you for supporting the JCO.